This video is intended for patients who have been fitted with an ASPEN TLSO, an LSO, or an LSO low profile, and provides information on how to care for yourself and your brace. It discusses the importance of a quiet environment in the healing process, the importance of proper skin care, how to remove and reapply the brace, and how to change the pads. Research has shown that early mobilization appears to be more effective than bed rest for most low back problems. However, the muscles and joints in the back must be maintained in a pain-free, quiet environment. Limiting the motion of the spine to create this quiet environment is a challenging task because each of the 25 joints that make up the spine is intended to flex and to extend. The ASPEN LSO has been developed to restrict motion of the lower lumbar spine, while the ASPEN TLSO restricts motion of both the lower and upper lumbar spine. To be effective, your brace must be kept on and properly tightened. Because the cushion flex tabs prevent the edges from digging in, for most patients, the tighter the brace is, the more comfortable they feel due to the increased support and motion restriction. Unless you have received other orders from your doctor, nurse, or orthotist, you should remove the brace only for skin care and possibly for sleeping. Pressure, moisture, heat, and dirt can all lead to skin breakdown if not attended to. To avoid this, keep your skin as clean, dry, and cool as possible. The design of your ASPEN brace minimizes excessive localized pressure, and by replacing the pads, you can stay clean and dry. Check with your doctor, nurse, or orthotist regarding when it is acceptable to remove your brace. While you may not require it, showering with the brace on does not represent a problem, as the plastic is completely non-absorbent and the pads are both washable and replaceable. Typically, you should remove the brace and wash your skin at least once a day. If necessary, at this time, replace moist or dirty pads with a fresh set. Often, the brace is to be removed and reapplied only while lying down and is to be worn whenever you are upright. When the brace is off, if you note any excessive redness, any skin breakdown, or experience any significant pain, consult your doctor, nurse, or orthotist. For the next few minutes, we'll be discussing removal of your brace, skin care, pad replacement, and reapplication. Your ASPEN brace should only be removed and reapplied with the help of a second person. Gather the supplies you will need: soap and water, a washcloth and towel, and a set of clean pads. While lying down, release and disconnect the 3 straps and the black start strap. Slide the brace out from beneath your back and, using a washcloth and towel, wash, rinse, and dry the affected area. Remove the pads by peeling them away from the hook Velcro. If needed, clean the plastic and Velcro with soap and water. Replace soiled or damp pads with a clean set. Position them so that the gray fabric attaches to the hook Velcro on the brace's inner surface. Be sure that pads are properly aligned so that no plastic will make contact with the skin. Having put on a clean t-shirt, position the brace so that it is low on the hips and the lumbar curve feels appropriately placed. Attach the black start strap to the Velcro dot to hold the brace in place. Now position the wide center strap through the lever latch, starting with the opening closest to the body and going back through the generally triangular opening. Having reattached the upper and lower closure straps, use the lever latch to tighten the brace. Note that all the tightening is to be done with the lever latch, which allows the brace to automatically adjust itself to properly fit your body. The closure straps are not used to tighten the brace, but only to hold it in position. The lever latch does the tightening work. The closure straps secure the brace once it is tight and maintain whatever angle has been established to provide an accurate, comfortable fit. The TLSO, because it is based on the LSO, has the same steps. However, the torso control straps, if used, and the shoulder straps must also be removed. To simplify strap management, tuck the torso control straps between the layers of the side panels and reattach the ends of the 3 Velcro straps as they are removed. For the TLSO, having a second person involved in the process is essentially a requirement. The curvature and position of the chest support rods and the lumbar support rods have been precisely adjusted and should not be altered. Reapply the TLSO, starting with the black start strap, which holds the brace in position. Next, lace the wide center strap through the opening closest to the patient, coming back through the generally triangular opening. Reattach the upper and lower closure straps. Use the lever latch to tighten the brace, and then snug up the upper and lower closure straps again. Now, reattach the shoulder and/or the torso control straps. To clean the pads, hand wash with mild soap and water. Be sure to completely rinse out all the soap. And finish by gently squeezing out the excess water. Allow the pads to air dry 4 to 6 hours. Do not place pads in washer or dryer, as the hypoallergenic cotton lining tends to fray. An optional cold therapy system is available that allows ASPEN LSOs to provide cooling to reduce pain and minimize swelling. A special back pad features a thermal sleeve that is positioned directly over the lower spine, which will accept a reusable soft gel pack. Cold therapy pads as well as replacement pad sets are available from your orthotist, doctor, or directly from ASPEN Medical Products.